Sally Grantham-McGregor is Emeritus Professor of International Child Health at the Institute of Child Health at the University College London. She's been chairman of the steering committee for the Lancet series on child development in developing countries. She's published extensively on the development of disadvantaged children in low and middle income countries. She's also won a number of awards, including the UNICEF Caribbean Award for Excellence in Child Research. She's been a consultant to UNESCO, to UNICEF, to the World Health Organization, to the Ford Foundation, among many others. We'll also hear from Dana Charles McCoy. She's an assistant professor at the Harvard Graduate School of Education. Her work focuses on understanding the ways that poverty-related risk factors in children's home, school, and neighborhood environments affect their development. She's also interested in development, refinement, and evaluation of early intervention programs that are designed to promote positive development and resilience in young people. Her research has taken her around the US and Brazil, Ghana, Tanzania, Zambia. She's also presented her work to audiences around the world, including the World Health Organization, UNICEF, and the World Bank.
All right. So good morning, everyone. It's really a pleasure for me to be here today. So I am Dana McCoy. I'm an assistant professor at the Harvard Graduate School of Education and a developmental psychologist by training. So today I'm going to be building a little bit on what Chuck and Kim were talking about this morning in terms of how adversity affects the brain. I'm going to take a little bit more of a behavioral perspective. My research focuses on children's skills and behaviors rather than brain development directly. And in particular, my goal for today is to answer two somewhat broad questions in a relatively limited amount of time. The first is, how does poverty affect children's skill development, and particularly their social, emotional, and cognitive skill development? And the second, taking a little bit more of an optimistic spin on things, how might we actually promote positive outcomes in skill development in the face of adversity? So building again on what was discussed this morning, poverty matters for a couple of different reasons. First, poverty is prevalent. The National Center for Children in Poverty here at Columbia University estimates that about 45% of very young children in the United States are considered to be low income, which is that they're at 200% of the poverty threshold or less. The scope of the problem is even larger and probably more intense outside of the U.S. 90% of young children around the world actually live in a developing country and face levels of poverty and adversity that are far more extreme than what we see in the U.S. We also know from a lot of the research that Kim overviewed this morning that poverty really affects children's development. We know this from neuroscience, developmental psychology, economics, sociology, that there's clear evidence that low-income children enter school far behind their more advantaged peers. And in fact, these gaps in income, in skill ability that are attributable to income actually emerge within the first few months of life. So my research is really trying to understand why we see these connections between poverty and children's outcomes. What are the mechanisms that try to explain these disparities that we're seeing? And in doing so, trying to uncover potential levers or targets for intervention for kids. So one mechanism we talked a lot about this morning, which is children's experiences of stress. There's also biological effects of malnutrition. So these are sort of individual within the child characteristics that might lead to sort of biological wear and tear and compromised brain architecture over the course of early childhood. Moving outside of the child, however, there's a number of environmental factors that are associated with poverty that may explain why low-income children are experiencing reduced outcomes relative to their more advantaged peers. At the level of the family, we know that low-income caregivers are less able to invest both time and financial resources in their children's development because of their own experiences of stress. This leads to lower quality learning environments within the home and outside of the home. We also know that family stability is a mechanism that can explain the link between poverty and early disparities, where low-income households tend to be more chaotic. Low-income families tend to experience higher levels of residential mobility, of transitions of individuals inside and out of the household. We know with great certainty from research that stability, predictability, routine are very important for young children. So when these disruptions occur, it can make them really hard for those children to learn. Moving outside of the family context, school quality also makes a difference in sort of explaining the links between poverty and early disparities. Low-income kids on average attend schools, not only K-12 systems, but also early childhood education systems that are lower in quality, they are lower in performance levels. They also are reported to be higher in terms of levels of unsafe environments or lack of nurturing environments compared to the more high-income people. And then finally, thinking about broader neighborhood contexts as well. We know that low-income families tend to be embedded in low-income neighborhoods. Low-income neighborhoods can confer a number of risks for children, including higher rates of community violence, as well as lower access to quality resources within those communities. So it's important to recognize that each of these pathways are not independent from one another. In fact, they're really tightly connected to one another. So these risks are not only additive, they not only add on to each other, but they actually in some ways are multiplicative or amplifying of one another, where early risk in one environment is actually going to lead to more risks in other types of environments. So my research is largely focused on this area of neighborhood processes, which are, we know just sort of anecdotally that the zip code where a child is born tends to be destiny in some ways for that child, and yet it's at the same time somewhat random. So trying to understand the neighborhood processes that explain children's outcomes is an area of interest for me. So on one hand, neighborhood violence we know to be detrimental to kids. So we've done some research in high violence cities like Chicago and Bogota, Colombia, looking at children from the same communities who are exposed to the same levels of resources and risk factors and in both those communities and their family units, and comparing children who had recently been exposed to a community violent event and those who had not. And what we found is that the children from the same communities who had recently been exposed to violence tended to be more impulsive and less attentive on a series of standardized neuropsychiatric tasks on a computer. They tend to be more avoidant of negative emotional stimuli, things like scary images or sad images. And as a result, over time, they actually showed lower test performance on academic skills. And this is just the result of one single violent incident. So if you imagine sort of the accrual of different crimes over time, these impacts add up. We also found, speaking to this the sort of multiplicative nature of violence and adversity, that effects of violence actually are partially explained by effects on other contexts in children's lives. So a caregiver who has recently been exposed to a violent event, we have just learned, is actually less likely to read to their child, to sing with their child, to play with their child, again, likely through these paths of stress that they themselves are experiencing. We have also found links between community violence and school quality, where higher levels of community violence over time translate into lower performance at the school level. Again, speaking to these multiple risks and how they might accrue over time. Neighborhood quality, on the other hand, is a little bit more difficult to quantify. So we can all sort of look at images of different neighborhoods or walk through different communities and have a gut instinct that some of them might be better for children's development than others. So this series of images is taken from Google Street View, and we see 2 early learning centers from the same city that are likely to be very different in terms of their level of quality and the characteristics that they are providing to children. So one of my goals recently as a researcher has been to sort of quantify these unquantifiable or qualitative aspects of neighborhood quality to understand how they might influence children's development. So along with researchers from Northwestern University, I've been developing what's called a systematic social observation tool, which is taken from sociology, that we're actually implementing through online systems, through Google Street View, to understand the sort of quantifiable aspects of safety and order in communities, child friendliness, as well as resources for child development, the availability of things like museums or libraries or green space, trying to identify the positive characteristics of neighborhoods that we might be able to in turn target through intervention. So this work is ongoing, and we hope to have some results published within the next couple months. So reiterating some of the messages that Kim mentioned this morning, I think it's really important to understand that although we see these average links between poverty and child outcomes, poverty is not destiny. There are certainly children who are exposed to poverty and adversity who will not experience negative outcomes as a result. In fact, there is some forms of adversity that can be tolerable or even advantageous if the right conditions occur. Stressful experiences are normative for kids. Taking a test or being challenged by a peer happens to all of us. And so experiencing these sources of stress within the context of positive and supportive environments can actually lead to greater resilience for kids. However, adversity tends to be most threatening under a certain number of circumstances. So first, again, when it occurs early in life, when children's brains are most sensitive to environmental input. Adversity is also particularly threatening when it's severe. So homicide will be more traumatic for a child, for example, than a petty theft. Adversity is threatening when it's persistent, when it happens continually over time, or when it's experienced directly by the child. So again, witnessing a violent event or being victimized by a violent event is likely to have a stronger impact on a child than simply hearing about a violent event. Adversity is also threatening when it's pervasive across multiple contexts in children's lives. So a child who's exposed to community violence plus bullying at school plus domestic violence at home is more likely to experience negative outcomes than a child who's simply exposed to one of those sources of risk. And then finally, and probably most importantly, this is a message that we've heard a number of times this morning, but I think it's important enough to reiterate. Adversity is most threatening when it occurs in the absence of protective factors, with the main protective factor for young children being the presence of a strongly attached, positive, responsive, warm, stimulating caregiver. That presence of that caregiver is really the most critical factor for children's success. It can be a parent, however, it can also be another adult in that child's life who serves that caregiving role. So that's kind of the bad news situation. However, the good news is that as researchers, we also have a number of pieces of advice in terms of how we might promote resilience for children facing forms of adversity. So the Center on the Developing Child, which has been mentioned a couple times this morning at Harvard University, has this really wonderful sort of image for thinking about resilience. And they liken resilience to a balancing scale, where if children have more negative or risk factors, here represented by the red boxes, their outcomes will tip towards more negative outcomes. However, if those risk factors are counterbalanced by positive protective factors over here, the scale will tip towards a more resilient or positive outcome. So when thinking about intervention, that kind of leads us with two overall types of options. Option one is to remove those sources of risk, reduce adversity that children are exposed to in their environments. The second option is to provide additional supports to children, to add on more protective factors in their children's lives. So in education, we tend to opt for option two over here, and in particular, the research that I do thinks about how we can develop skills that children need to be successful in life, despite the fact that they are experiencing trauma and adversity. So these types of skills are the types of things that allow them to cope with the aftermath of trauma. However, they're also the types of skills, coping skills, problem-solving skills that can allow them to face negative circumstances and make smarter decisions and break cycles of violence over time. There's a common misperception that these types of skills simply take willpower or motivation, and in fact, that's not the case. Children need to learn them explicitly. We need to teach them explicitly, and they need to be modeled to them appropriately in order for them to be learned. It's not a simple matter of making children grittier or more motivated. These are types of skills that have to be taught. So what are these skills? What do they look like? I call them social-emotional skills. Other researchers call them non-cognitive skills or 21st century skills or soft skills. There's a lot of different names. It's very, very confusing. But overall, in the early childhood period, I break them into three different domains: social, emotional, and cognitive. So they include things like social competence, the ability to get along with others, kindness, respect, empathy, the ability to identify emotions in oneself and in others, the ability to respond to those emotions appropriately given the environmental demands. Within the cognitive domain, there's also impulse control, set shifting, or the ability to shift attention from one thing to another, as well as memory. Collectively, these are the skills that represent this domain of executive function that we've heard a little bit about so far today. So executive function you can think of as the brain's air traffic control system. It's what helps children to take in a lot of different complicated information, to organize that information, and to respond in a goal-directed kind of way. So why are these skills so important? Why do we need to teach them? We know from a great body of both correlational and experimental research that early social and emotional skill development, things like paying attention in school, waiting for turn, controlling anger, are strongly predictive of later life outcomes in a number of domains. So things that we in education care about, like school outcomes and learning, but also outcomes that policymakers and the general public tend to care a lot about as well. Things like physical and mental health, reduced violence and incarceration rates, as well as improved earnings. We know from this body of research that these early social and emotional skills are actually in many cases more predictive of these later life outcomes than things like IQ, which we often view as being really central to kids' success. So how do we improve social and emotional well-being, the million-dollar question? My research is focused in particular on addressing these challenges within Brazil. I know many of you in the room are from Brazil. So Brazil, in many parts of the country, is experiencing high rates of community violence in response to some recent political instability and economic instability. This has real implications for young children's educational outcomes in terms of school closures as well as disruptions to classes. There's also large socioeconomic inequality in Brazil. So these two images, again from Google Street View, are from Rio de Janeiro, and they're taken less than a mile apart, and they represent very marked differences in the types of environments that children are exposed to in these settings. Despite these risk factors, Brazil, I think, is relatively unique in its commitment to early childhood education and child development, both from a governmental perspective as well as from a private sector perspective. There's a number of really progressive policies that have been implemented in Brazil to support universal pre-primary education, as well as universal supports in terms of childcare for low-income children. The quality of those programs is somewhat questionable in cases, but they've made a lot of progress over recent years. So in terms of intervention, I think the good news is that any program or policy that supports kids' well-being broadly is likely to have an impact on social and emotional skills. So things like high-quality preschool, or early home visiting programs, parenting programs, programs to support parental mental health. All of these types of approaches are going to have improvements on kids' social and emotional well-being. However, there are also approaches that we can take that are more directly targeting these specific skills. So one approach, which has been quite successful in previous research, is the use of comprehensive curricula that include lessons, just like a math lesson or a science lesson, that supports children's development of specific social and emotional abilities, like the ability to identify emotions or respond to conflict. So in Brazil, we're currently running an experiment, a randomized control trial of a program called Programa Compasso in Rio de Janeiro to try to understand whether this type of approach may also work outside of the United States. Most of these programs have been tested in the US only. More recently, there's been a number of approaches, particularly led by work by Stephanie Jones at Harvard, to simplify some of these curricula. So Kim mentioned this morning that one of the challenges of school-based programming is that they're very clunky. They take a lot of effort to implement. They're costly. We don't have time in the school day often to carve out for social-emotional learning, given our competing priorities in math and science and reading and these high-stakes testing environments that we're facing. So what we have been doing in Brazil is pulling out the evidence-based activities and strategies from these larger curricula and creating 5-minute activities that teachers can implement basically at any part of the school day. So from the transition from a lesson to recess, they can implement a quick little game, what we call a kernel, in order to sort of weave social and emotional skills into the fabric of the school day, rather than thinking of them as sort of a standalone component. So we have bbeen testing in Sao Paulo a series of these kernels called the brain games, which are specifically targeting executive function and self-regulation. And what they look like is basically a tiny little card. It looks like our little recipe card that has simple directions for an activity, in this case the hot potato memory game, which is a lot of fun for kids. The card also includes instructions to make the activity more or less difficult depending on the ability level of the child. It also has questions to help teachers debrief about the types of skills that children were using in order to help them to make these activities and these skills a little bit more conscious and explicit. So again, we hope to have results from both of these studies within the next several months. So in terms of best practices for intervention, we have learned quite a bit. So one best practice, not surprisingly, again, the theme of the day is to start early. The earlier the intervention, the better, the more likely to develop skills that kids need to succeed. It can never start too early. In terms of social emotional learning in particular, models that are safe tend to be more effective. So SAFE standing for sequenced. They show progressive skill development that builds on simpler skills over time. Active development, activities where children are actively engaged, like the hot potato game, focused on a specific skill as well as explicit. So again, making the skill development explicit to the children so that they know what they are learning and can make that more of a conscious experience. Another best practice is to don't forget about the adults. Often in education, we make the mistake of thinking of adults as simply the deliverers of an intervention. In reality, teachers and parents are facing the same forms of adversity as the children that they're caring for. And supporting their own mental health and well-being is a critical component of helping children to succeed. So there's been a sort of resurgence in what we call dual generation programs over the past several years that I think is a really positive direction for the field. It's also important to target multiple contexts. In our Programa Compasto evaluation, we're implementing the program at the school level, but we're also sending SMS audio and video messages to parents with the hope of reinforcing the content that kids are learning at school at home and sort of creating greater continuity and predictability and stability in expectations around social emotional learning across contexts. It's also important to build skills and use approaches that are contextually relevant. As I mentioned, most of the social emotional learning programs that have been used so far have been developed in the United States, and we have found that there are certain aspects of socio-emotional learning that are more or less salient in Brazil. So we talk about emotion regulation with Brazilian teachers, and they questioned us and said, why would we want children to regulate their emotions? They should embrace their emotions and express their emotions. And so trying to think about what are the skills and contexts that are relevant to the setting, and how do we make sure this actually makes sense within the given context. The next message is to be patient. Often these types of approaches take time for the results to actually show up in the world. So it takes some time for the brain to develop. It takes some time for the behaviors to develop. So it's important to carefully track kids over time. And then the last point, I think, also speaks to one of Kim's point that she made this morning about the fade out of intervention effects. There's been a lot of sort of pessimistic news about how early intervention effects are great in the beginning and then they fade out over time. My hypothesis that is shared by a number of other researchers is that we're simply not measuring the right things. So in early childhood, the types of skills that really matter, again, for the long-term success of individuals are these social and emotional capacities, whereas most of the time in prior intervention trials, we have measured things like IQ that may be less salient. So I think if we focus on these social and emotional skills, we may have a better sense of long-term efficacy. So I'll end with just a quick quote from Jack Shonkoff, who's the director of the Center on the Developing Child at Harvard, and I think this is a really nice summary quote. Jack says, when we think that kids just need the willpower to overcome adversity, we miss opportunities to provide the relationships and build the skills that can actually strengthen resilience. And I think that this is a really nice summary of the work that's needed to be done. These skills are things that can be learned. Relationships are incredibly important and foundational, and together with this body of research, we hope to be able to really support not only our most vulnerable children, but all young citizens, both in the United States and internationally. So I'll leave you with my website and contact information. Please feel free to be in touch at any point. And I also would point you to the wonderful Harvard Center on the Developing Child, which has a ton of resources for translating really complicated scientific facts into really interesting and digestible results. Thank you.
I would like to thank the Dart Centre for inviting me. And I'm really excited to be talking to a room of journalists. I've never done that in my life before. And I've always thought that you actually are very important in getting messages out, and we haven't used you. Or maybe that's not, we haven't collaborated enough with journalists. And I'm going to talk mainly about a program. I'm going to talk about what can you do about it, rather than what happens when you're poor, though I will mention that. Let me just start. There is considered to be a global problem of over 250 million children under 5 in developing countries who are not reaching anything like their potential in development. One of the reasons I put this up, because this is an example of neglect, and I thought it spoke very nicely to Professor Nelson's comment about neglect. This was a child in Kingston, Jamaica. And I must say, when I first went to Jamaica and went and started visiting poor homes, the thing that really struck me was that the kids were doing nothing. They had nothing to do. And the malnourished children in the ward had nothing. They were in a cot on their own, and the mothers weren't visiting, just like your institutions. And just giving them a few things to do made a difference. Anyway, I won't go on about that. But this is data we collected in Bangladesh, and this is complementary to the brain data. And even if you're not sure about whether the brain data is valid and all the rest of it, and you don't understand it, you can understand this. This is the cognitive development of children divided by the wealth quintiles at birth. So, and they were all rural villages in Bangladesh. And these were over 1,000 kids, right? And we followed them from birth. And at 7 months of age, in a test we gave of cognitive development, there was a 0.2 standard score difference in their performance between the richest, and none of them were rich, they were poor villagers, right? Between the richest and the poorest. By 18 months, there was a 0.68 standard score difference. By 5 years, there was a 1.2 standard score difference. And if you're going to try and extrapolate that to an IQ difference, that's way over 15 points. So they're going to then go to school, which is going to be a worse school than the better off children. So the chances are pretty much finished. Not necessarily because they couldn't do better, but they won't have the opportunity to do better. And we looked at what explained that gap at 5 years. And what we found, I don't have a pointer, but birth weight or birth length contributed a small amount to that gap. Growth in the first 2 years, because we had quite a lot of malnutrition, contributed more. After 2 years, growth mattered, but not nearly as much. But the interesting thing here was that stimulation in the home was very important at 18 months, but even allowing, this is a residual, even allowing for the stimulation in the home at 18 months, stimulation up to 5 years still played a point. So we mustn't be too far carried away with 1,000 years. 1,000 days. Okay, now for the rest of the time I'm going to talk about Jamaican intervention. And it's dear to my heart because it comes out of a developing country, and very little research in developing country ever gets mentioned. And you all come from developing countries, or a lot of you, and you should big up your own researchers. Give them a chance. That's Jamaican, big up, I'm sorry. Okay, so the underlying principles of the Jamaican intervention, which is a home visiting intervention, is supporting mothers to promote their child's development, which echoes very well with the talks this morning. So we're not just working with the child, we're working with the mothers to help them improve their child's development. And we tailor our activities to the child's specific ability, not to their age, to their ability. So we're always at the edge of their zone of development, so it's not too difficult, but it's not too easy. The intervention's culturally appropriate for poor children in low-income countries. We use paraprofessionals or local women who we train, and we use homemade toys, and that is to keep the price down. We've tried weekly and 2 weekly home visits, and recently we've tried putting the play in the local clinic to save the time of the workers going backwards and forwards. And we've tried small groups, and they all seem to work. And it's a cognitively structured curriculum. So the workers, because they're paraprofessionals, because they're not highly educated, they need to know what to do at every single visit. Now, we have quite a strong evidence base. We've run 15 trials to date, published to date. 12 were randomized. And you can see where they were done. And there's 2 recently completed Indian studies that aren't published yet, and 2 in Bangladesh. The target children, we've been with low birth weight term babies, we've been with malnourished, severely malnourished, stunted children, disadvantaged children, urban slums, remote rural. Now, they've all had concurrent benefits to children's development. Most also, I think they nearly all improved with home stimulation. So the mothers were providing a more stimulating home. The mother's knowledge improved, and we didn't always measure depression, but it often, maternal depression often improved, though we were not targeting it particularly. But we were visiting, we were listening to the mothers. We've done 5 long-term follow-ups at these different ages, and so some of them aren't so long. And 4 of them have sustained benefits. The one that didn't was the one we followed up at 4 to 5 recently. And I may talk about that more later. I can't tell you about all these studies, so I'm just picked 2 studies to talk about. This is the very first study with severely malnourished children in hospital. We repeated this in Bangladesh with the severely malnourished children. I'm delighted that Chuck has done the brain studies, which we were trying to do years ago and couldn't get the funding for. Because people were saying stunted children are just adapted to their environment, there's nothing wrong with them. This is one with severely malnourished children. It was small and it wasn't randomized, so I'm giving you the limitations right now. Oh, sorry. This is their results. We followed them up for 16 years. They were actually 17 at the end there. Now, the pink are severely malnourished children that had routine care. Now, we didn't think it was ethical to randomize them because it was all in the same hospital. So those came through a year before. And then we intervened. We introduced an intervention in hospital. They stayed in hospital 6 weeks. We played. I actually did some of the playing myself. We played with the children an hour a day. And then when they went home, we worked with the mothers. And you can see what you call a fade out. There is a suggestion of a fade out. They made tremendous improvement in the first 2 years. And then in the 3rd year, even though we went on visiting, they came down a little bit. And then we stopped, and they came down a bit more, and we thought, oh, goodness, it's finished now. And then it came back a bit. And there was 0.6 of a standard score in IQ at 17 years of age. So I was pretty encouraged at that. Now, the other study I'm going to talk about was one that has attracted more attention, and I'll tell you why later. And they were with stunted kids. And we wanted to know, is it food, is it stimulation, or is it both? Well, surprise, surprise, it's both. So this is the results. The pink, the controls, declined. This is their developmental level, and it declined over the 2 years we follow them up, as most poor kids do at this age. The supplemented took a long time to improve, but they eventually did improve. At 24 months, they improved quite a bit. The stimulated improved quicker, but they ended up fairly similar to the supplemented. The ones that had both actually caught up with a reference group of non-stunted kids from the same neighborhoods who were also poor. Now, we followed those children up to 22 years. We've actually followed them to 30, but that data's not published yet. But we found At 22 years, they had a better IQ. They had done better in school. I'm not 100% convinced that it's all social emotional, because I think doing better in school, that has effect on social emotional. At 12 years, we had no effect on social emotional. But by 17 and 22 years, we had less depression, better social skills, reduction in violent behavior, which we all know is very important in Jamaica, and higher wages. Now, that is when we managed to get notice, the 25% increase in money. And I think it's very sad. We'd been publishing for all those years in decent journals, and nobody ever cited it or referenced it or anything or could give a damn about it. And then we showed that they were earning a bit more money, and suddenly everybody wants to use it. This is their IQs, and you can see there is a hint here again of the kind of fade out and then retaining. Now, I know the Abecedarian, no, the high scope didn't retain, but the Abecedarian did, right? But we did retain. In fact, our results are very similar to the Abecedarian, which had a lot more input, because they had, I don't know if you're familiar with an American study where they brought the children in almost from 4 months every day to a center, and they also did home visiting, and they went on till about they were 8 years, and they actually had a school intervention too. And we managed with paraprofessionals and homemade toys and visiting backyards to get almost as good, I think as good actually. Now, what does the curriculum look like? It has a series of games, and they're all arranged in order of difficulty. The idea is you put the child at their level, and you move them up every week. And if you find it's too difficult, you move them back, and then you move them up. And if it's too easy, then you move them forward. You don't need to do developmental assessments all the time. You just keep them going. Sorting and matching form boards, picture books, a series of picture books from simple pictures to stories. Anyway, to be quick, this is the sorting and matching type activities we had. These are the type of the form boards we had. Now, one thing we did think was very critical, and we don't have data to support it, but we think the relationships between the visitor and the mother is critical. And you won't get that right if the relationship between the supervisor and the visitor isn't good. And then you go right up the line to the person in charge has to relate to the supervisors. And it sounds simple, but they need to listen, to give positive reinforcement, to show respect. And in some cultures, this is quite difficult because there's a class difference coming down the line. And we've found it necessary sometimes to add special workshops just on relationships for the supervisors to get to understand. I mean, I had a trainer who would not sit down with a child who had been a teacher and pour out a drink when they were giving an interview. Because she'd say, we pour out a drink for this child. I'm more important. So these kind of relationships are really important. All right. Now, Reach Up, what we did is to enable us to spread to other countries, we made a web package. And Sue Walker and Christine Powell and Susan Chang in Jamaica have really headed this part of it up. But it has been a collaboration between our Bangladeshi colleagues and colleagues in the Institute of Fiscal Studies. So it's been very good. And we've had, for instance, Bangladeshi colleagues have gone to India to help train them as we've spread it. The aim of the Reach Up package was to increase the capacity to implement these types of programs. The package has lots of manuals, adaptation and planning to implement, toy manual, play materials, curricula, training manuals with videos, etc. This is some of the videos. We have 3 lots of 15-minute films of home visits from Jamaica, Peru, and Bangladesh, and we've got 28 clips. It's available in several. It's also available in Mandarin. These are the countries we're now in. Sorry, that was a bit quick. But this is a list of the countries we're in at the moment. The Peru is a national program now, and China is in 3 provinces and planning to go to another 3. So in some countries it's taking off. We're also now working with the International Rescue Committee in Jordan and Lebanon. And we're starting in England. I don't know if it's going to work in England, but we've got money now to start piloting in England. And Jamaica has just started. The Ministry of Health just has started to incorporate it. These are pictures from Zimbabwe, Guatemala, Bangladesh, Bolivia. This is my favorite picture. This is China. This is visiting. And I had a pathetic little note from Mary Young, who said, "Do we really have to go every week?" And I emailed back and I said, I thought fortnightly was fine. All right, I'm going to be late. One size does not fit all. As you can see, all the books and pictures have to be changed to fit the culture. The children need to see what's familiar to them. We use local games and things. Going to scale and maintaining quality is a major challenge. Lots of reasons given, but they reduce training, preparation time, supervision, which I think is critical. They reduce frequency, duration of visits, staff change all the time. And the other thing is they want to address every single need. Everyone that gets up here say we add maternal depression. Fine. They want to add nutrition, hygiene, health, family planning, maternal depression, HIV, domestic violence, agriculture. And other people see visitors as a job for work for school leavers or for the unemployed. And sometimes it's for political job giving. So problems. And then there's the question of, do you integrate into existing services, which education, health, nutrition, social welfare, or do you establish a new service? Advantages of integrating are obvious. It's lower cost. The same children who are high risk for health and nutrition are also at high risk for poor development. Access is already there. It's more likely to be sustainable. Disadvantages of integrating, lack of capacity, not being able to meet their own targets. I don't know if you're familiar with developing country health services. Some of them are not very good. Child development may not be their priority. Routine health services, too few contacts, and they stop too young. So it's a challenge. I'm not saying don't integrate with the health services, but you have to be aware of all these things. This is an example of a health clinic in Jamaica, and it's one of the better ones. I've seen much worse than that. I will skip that. So in conclusion, there is a major problem with poor child development, and it's reinforcing inequity worldwide, probably in this country too, almost certainly, because you've got big inequity here too. So do we in the UK. We know how to solve it, but going to scale is a massive challenge, and we have to get it right. And so we have to think very hard before we leap in and go to scale. And I'm hoping that you will advocate, because we have to get the government's buy-in. The local governments, they have to invite us in, otherwise it won't work. Thank you.
So we now have time for some questions. Are you going to hand around the mics? Okay.
This is for both Sally and Dana. I'm curious if either of you have thoughts about how we should be thinking about and reporting on the time frame of these evaluations. And I'm specifically asking because it seems like there's been quite a bit of research in the last few years where the initial evaluation showed a fade-out effect, as you mentioned, and then the researchers go back 10 years later and they see an effect. So how should we be reporting about that if the study is only a 2-year study?
You have to be truthful. You can't do anything else.
Yeah, I mean, I have a lot of thoughts on that. I think it's a real challenge. I mean, one of the issues I think is that we haven't been measuring the right things. So Greg Duncan, who's actually one of the collaborators with Kim on the poverty project, often calls this a resurrection effect, right? Where we see initial fade out and then all of a sudden 10, 20 years later, we see this resurrection in terms of adult income, earnings, and health and incarceration rates. So I think one of my hypotheses is that we haven't been measuring the right things all along. I think if we were measuring things like executive function or other sorts of non-cognitive social emotional skills, we might have seen a persistence the entire time. I think the other thing with fade out is that we often put a lot on the backs of these early childhood programs we assume that this is going to be an inoculation or some sort of panacea against all forms of adversity to come. And it really, it's unfair to expect a several-year program early in life to combat really low-quality K-12 systems or high levels of community violence. It's just setting up expectations for failure. So I think that that's some context for some of these findings. In terms of what you report, I think as Sally said, you report it truthfully, that there may be initial fade out, but I think the other context to think about is it could be that the children who are not receiving the intervention have simply caught up because there are now more services available to them to support their well-being. So on average, we may be bringing both the kids who received the program and those who didn't to a higher level than we had before in the absence of the program. So the fade-out issue is really complicated, and I think as researchers we're only beginning to sort of unpack that now. But I would report it truthfully, but trying to add some of this additional context that I'm mentioning in there.
Yeah, I don't think there's that much data, quite honestly, there's a high scope, there's a clutch of North American, which were high input interventions. I don't think there's that much data on long-term follow-ups. There's just a handful of studies. So what we need is more measurement of these children, because and the other thing is the ones that sustain do seem to have quite a big impact initially. So the average impact is about 0.3 of a standard score. I'm not sure if that's sustainable. I haven't seen any data to show me that's sustainable. And that is the average impact. So the ones that were sustained had big impact, 0.6, 0.8, even 1. So there's a lot of optimism. We need a little bit more data, but I think we need to put quality into it before we go to scale. Quality control. Got to have good supervisors. No, they skip the supervision. Instead of a supervisor going once every week or meeting once every week and going to the field once a month with every visitor is what we did, that you're now going once every 9 weeks. Well, if you're taking people who've never done it before and you've given them, the other thing is if they're integrating into a service, you can't release them from their everyday work. So you can get 2 days to train. 2 days to train someone who has no background in child development. You'd be challenged to work in a home visiting after 2 days to train. It's really stupid.
Okay, Nigeria has just taken over from India as a country with the largest number of people living in extreme poverty. And I'm just wondering if there is going to be intervention, how is it going to look like, using the scientific approach? And for us that are journalists that are writing on this, if you are using evidence-based reporting, what kind of intervention should we be looking at?
We're doing an intervention right now with the Institute of Physical Studies in Yale, in Odisha. And we're doing a home visiting. And we're also doing small groups. And that works just as well. And so that's more effective, I think, probably, small groups. And you've got the Anganwadis in India. At least you've got this infrastructure there. They need upgrading. We are collaborating with the Anganwadis and trying to upgrade what they're doing there too. But it's possible. You've got this enormous infrastructure of Anganwadis. I know they start at 3, but you could start by improving those.
Yeah, I will just add on to what Sally is saying. I think that home visiting is a very promising intervention in low and middle income countries. It has been proven sort of again and again, largely because the infrastructure is typically there. If you already have community health workers going into families' homes to talk about immunization and nutrition and WASH programs. It's quite easy to integrate. Well, I shouldn't say quite easy, given all the challenges that Sally just mentioned. It's not easy, but the infrastructure, as she said, the infrastructure tends to be there. But there are lots of examples, as we talked briefly in the break, in sub-Saharan Africa, of countries that are really leading the charge in terms of early childhood education. So Ghana, for example, peri-urban Accra has some of the highest rates of preschool enrollment of any country in the world, including it's better than the United States. So I think that there are other ways, in addition to home visiting, that countries can take the lead. But it is about prioritizing in certain circumstances. You can't do both. You can't do everything. So it's about evaluating sort of local needs and political priorities and making the best decisions with the resources that are available.
Jenny?
Two questions for you, Dana. One is you talked about sort of how there's a lot of research that shows that socio-emotional stuff is more important than cognitive stuff, and yet it's exactly the opposite direction that pretty much many developed countries are going with respect to preschool education, which, kindergarten is the new first grade. Why do you think that is? And then the second question is, do we have the tools? We're talking about executive function, for example, potentially being a much more, or grit, or all of these things that have become very popular. Do we have the tools to measure them effectively? Thank you.
Yeah, great questions. So again, I'll start with the second. I'm very interested in measurement of these processes because I think you're exactly right. They're very challenging to measure. Grit is difficult to measure because it's inherently something that you have to report on your own. So that can lead to bias where people like to overestimate potentially. Some people like to overestimate their abilities and others will systematically sort of underestimate what they're capable of. So I think Angela Duckworth, who's sort of coined the grit term, she's been thinking a lot about how to sort of mitigate those biases, and that's sort of increasingly salient for her. Executive function is a little bit more complicated, and the nice thing about executive function is actually we have computerized tasks, for example, that we can measure objectively and without bias that ask children to perform sort of challenging games or tasks that will really challenge their attention and make them sort of inhibit their natural impulses. So one non-computerized version of a task that we often give to preschoolers is called the pencil tap, and we give a child a pencil, and there's an assessor who has a pencil, and the instructions are basically when the assessor taps twice, the child has to tap once, and when the assessor taps once, the child has to tap twice. So the idea is that the child has to remember the rules of the game, and then the impulse is to mimic the assessor by tapping only once when they tap once or twice when they tap twice. So it's an inhibition task. And that's objective. That's not biased. It's very easy to measure. It's very easy to quickly implement in 5 minutes, and it actually is a very robust predictor of school learning and other types of outcomes. So I think that there are creative ways to get around some of the biases in measurement that we're getting better at as researchers, but we still have a long way to go. In terms of your potentially more difficult question about the balance between social-emotional skills and cognitive skills, first of all, sort of as I represented in the Venn diagram, I don't think that social, emotional, and cognitive abilities are separate entities. In many ways, there are skills that are involved with both of them. And in fact, I think that there's evidence from really high-quality preschool curricula that are able to support content learning at the same time that they're supporting these non-cognitive abilities. And so I think in many ways, preschool curricula have really led the charge and in that area because developmentalists and educational professionals and just the general public have known for a very long time that preschool is not just about numbers and letters, it's about socializing children and helping to encourage problem solving and creativity. So those are largely embedded in preschool curricula. I think there's a push and pull that I see in modern conversations about how much preschool should be moving towards more academically oriented versus how much it should be pushing away from that. Different countries have different comfort levels with that. In Brazil, again, they just released their sort of national common core, and it's almost exclusively social and emotional. There's almost no mention of early literacy or math, whereas in the United States, we have a much more focus on academic learning. So I think there's a lot to be learned there about what the balance is, but I don't think that those are necessarily at odds. I think that there are effective approaches that can integrate those and really be successful in doing so.
Did you have one more?
Hi, this is Anona from India. And my question is to both of you because you both spoke about the psychological well-being of the caregiver, the parent. And in our country, you know, if you seek help, people look down on you. Like if you go to a psychiatrist or a psychologist, people look down on you. So in such a situation, what is the impact on the child when the mother or both the parents have some sort of issue? And secondly, what can you do when the people themselves, and it's not just very much so the people from the poor economic strata, but also the people who are well educated, they do not want the help. Even if someone is ready to give it to them, they feel hesitant to actually seek out. So what do you do in such a situation?
It can be integrated into the home visiting care for a depressed mother. But if they're clinically depressed, you can't really expect paraprofessionals to deal with that, I don't think. But if it's just, a lot of poor women are depressed. They have a lot of depressive symptoms, but they may not reach the criteria of clinical depression. But they did a study in Bangladesh where they spent half the visit focusing on maternal depression and half on the regular home visit, and both improved. But I think the child's improvement was slightly less. But the other thing is, I don't know of any study which shows that you can improve maternal depression and subsequently the child improves, though there is a well-known association between the two. Do you know of any?
I don't. I think it's a good question. Yeah, I mean, I would agree with Sally. I think that there are kind of multiple approaches that need to be taken in that situation. One is sort of a bottom-up approach where providing services potentially in the context of home visiting that's happening anyway, where the stigma is less, providing services and screening for maternal depression or anxiety or other mental health issues and providing those within that. But there's also a top-down approach that needs to be taken, which is simply changing norms around mental health and making sure that it's not stigmatized and that seeking appropriate care for mental health issues is something that is celebrated rather than viewed as shameful. I'm not an expert in that area, unfortunately, but I think that combining those two approaches simultaneously is likely to have the maximal impact.
Dr. McCoy, we've got, I'm really interested in the Google, the new tool that you're using to look at safe and unsafe neighborhoods in Brazil. So South Africa's also got, huge inequalities. And what has happened is that they've got community mapping processes for children to, I think maybe Jane knows a little bit about it too, but they look at, they get children to map where they feel safe and where they don't feel safe. And then that data is collected. The trouble is, and this is what I wanted to ask you, is how in a place in like South Africa and even Brazil, where there's numerous issues, how do you take data, rich data like that, and give it to policymakers so that they are aware of how to make safer spaces for children? And I am aware that there is another talk on that, but I'm just so interested in how how your research has panned out.
We haven't gotten that far yet, so if you have advice, we'd be quite welcome to it. I mean, I think it speaks to the earlier conversation this morning about the challenges of communication and getting the research into the right hands once it's sort of been developed. But I think for us, one thing that we've been thinking about very carefully the entire time is having conversations along the way with policymakers and foundations in Brazil that are very active in advocacy, so that when the results come out, the policymakers are actually looking for them rather than caught by surprise. I think the other thing that I as a researcher often think about is making information very simple and accessible. So rather than simply publishing a technical paper that's into a journal that no one reads other than the other academics, thinking about making policy briefs as part of the publication process or simple lay summaries. And I think that researchers are increasingly getting better at that, but in general, we're pretty bad at communication strategies, and we often rely on you guys to help us to translate some of our findings. So I'd be eager to hear the same answer. I'd be eager to hear the answer from everyone in the room to that same question.
Thank you. Looking at the socioeconomic condition of children, child labor is a big issue worldwide, we can say, especially in the South Asia. If we talk about India, Bangladesh, Sri Lanka, are in Afghanistan, Pakistan. For example, in Pakistan, the International Labour Organization report says that there are more than 12.5 million children who are involved in the child labor. Same is the case in Afghanistan. 26% of children in Afghanistan are involved in the child labor, and in India as well. My question is, how much the child labor contribute to the children adversity? And have you worked on child labor, both Dana and Sally?
I want to add something. Child labor is a problem in Turkey too. We have like 2 million children in labor, but also labor within the house, in the house. So if you can answer the question, concluding that too, I would be.
I've looked at both of my colleagues, and I don't think any of us is unfortunately an expert in this area. I mean, my reaction to that question is thinking about what stresses may be present in child labor situations, so either paid or unpaid labor, if there are threats of abuse or neglectful circumstances that go along with that. I think that could obviously have negative implications for kids. I also potentially more saliently think about what could have been happening, or what learning opportunities should have been available to the children whose time is being spent in labor. So often child labor involves removing children from school and compromising their ability to learn. So I think that those are probably, again, I'm not an expert in this area, but I think for me those are probably the two competing challenges of child labor, is the threats that they're exposed to as part of that labor, but also then the missed opportunities that they're not able to take part in because of it. I don't know if you guys have.
No, I haven't worked with older children.
Hello. Yeah, I'm Manish from India. My question to both of you is that first thing you made a remark that a zip code is a child's destiny. So do you think just after a few months of his a child is born, his zip code should be changed by by taking him to a better care home? Secondly, you talked about a lot of intervention. But do you think that the basic problem is that when we talk about intervention, we talk about uniform intervention? But what is good for Jamaica cannot be good for Bangladesh or for India. So there should be a country to country specific, region to region intervention.
I'm afraid I had to cut those slides out. We spend a lot of time adapting to the culture. We redraw all the books, all the pictures. We use the local toys, songs, games, pretend games, everything. And obviously we work with local experts who have their input. So, I mean, a block is a block, a crayon and a paper is a crayon and a paper. There's a lot of things that are international with child development, but it has to be in the context, correct? And we always work with the local professionals to adapt. And it's worked perfectly well in Bangladesh and in India, because we spend a lot of time adapting.
Yeah. Sorry, I'll just quickly add to that. I think the principles of child development, the basic principles, are also universal. So the fact that children need warm, responsive caregiving, what that looks like may take different forms in different cultures, but the existence of a strong caregiver relationship is critical. So I think that there are these universal lessons that can be translated and learned from different context to context, the specific manifestations and materials and how you might teach it or prioritize it look different, but we do know quite a bit about the foundation.
Hello. Hi, this is Irene from Italy, working mainly out of Latin America, and I wanted to ask about interventions when it comes to violent contexts. I'm thinking specifically of a story I was reporting on in Juarez on the Mexico-US border. I was there when it was the world's murder capital, and I actually, spent some time with teenagers who'd been involved in violence, who had younger brothers, who had seen many corpses out in the streets kind of on a daily basis. And when I went back last year, I started, so the numbers of suicides among teens, so between 14 and 18, had risen quite significantly, and I started asking, and psychologists were baffled by this. In a way, they were just, saying, oh, of course, this is a violent city, like nobody cares about life. But it was very interesting to see that there wasn't, it was striking to me that nobody was kind of thinking about how violence could have affected children, etc. So I guess it's about violence, but I also wonder about sort of depression as well in children. Thank you.
Yeah, I think that's spot on. I think that often when we think about community violence, we think about the people who are directly victimized by the violence or their families, and that kind of is where the story stops. But the research that I was presenting today suggests that the reverberations of that violent incident can be huge. We found the effects of community violence on children even when the children didn't consciously hear about or know about that particular violent incident, and that's largely, we explain, because the environments around the children are changing. The caregivers are interacting with them differently, their stress levels are going up, their teachers are more protective of the children, allowing them to explore their environments less. So the indirect impacts that violence has on children from a very young age to to adolescence is huge, and so it's not just attention and executive function, it is mental health. And again, if you have those contexts, like the ones that you were working in, where those incidents, they just pile up, and the consequences as a result pile up. So yes, there's definitely research to suggest that community violence is associated with mental health challenges, both internalizing like depression as well as externalizing like greater aggression. That's not surprising, unfortunately.
There's quite a nice intervention for preschools that Helen Baker Henningham is doing, and she's done several studies in Jamaica now, and they've been quite successful, working with teachers to teach pro-social behaviour and discourage antisocial behaviour, and to make the classroom a more friendly place. Because in these type of communities, the school is pretty hostile, and she's reduced aggression amongst the children, and she's reduced aggression of the teachers to the children, which was a big problem. A lot of beating of kids going on, even though it's not legal. So she's had very good results, and she's been invited to spread to the whole of Jamaica, which I thought was very good. So it can be tackled, but I think adolescence is almost too late.
Well, I don't know if I'm allowed to get back to a theme of less talk, but I would like to Dr. Nelson to talk about ethics, and maybe Dana and Sally also could say something about it. As journalists in this team, we are always facing ethical issues and reflections, and I would like for you to reflect also on the ethics by the point of view of researchers, like you are picking up groups and intervening, and maybe on the house beside there's an impact on a house and the neighbor didn't get that impact. So I think that's an ethical issue for you. So I would like to give some thoughts about it.
Okay, so let me first say that I appreciate the question. We and others have written extensively on the ethics of the work in Romania, so I'm happy to share those papers with you, but here's sort of a brief version of it. We could do a randomized control trial in part because the Romanian government considered institutions an intervention for kids who had been abandoned. They were staunchly opposed to anything else. So we were invited in by the government to do this, by a member of the government, to do the study to actually see if kids put into foster care would do any better than kids in institutions. And they were convinced the study was a waste of time. Second, because there was no foster care in the city, in the government when we started, we had to create our own, and we could only find so many families. So we weren't withholding treatment because there was only so much treatment to go around. Okay, so that's the second thing. A third thing is that we had a policy of non-interference. What that means is that I think I may have led you to believe that the 68 in the institution and the 68 in foster care stayed like that. Nothing was further from the truth. In fact, The government decided what happens to the kids. And so over time, the vast majority of the kids in the institutional group left the institution. So by the time the kids were about 12, there were only about 20 kids still in an institution. The government took them out, they reunited with their families, they put them in government foster care, things like that. So there were changes in group assignment overall. We analyze our data based on the original group assignment. That avoids sample bias. But the reality is that kids change their group assignments. We provided, for the foster care kids, we provided all material support, psychological support. We made referrals. We continue to do all those things to this day. So we didn't just look the other way. We work closely with the government to start this. So the way we did this was actually awkward. In the second year of the study, when we started to see the big effects we had, we called a national press conference, and we invited members of the government and, of course, all the press, and we announced our findings. And we said, look, the kids in the institutions are doing much worse than the kids that we put in foster care, which is our way of saying, so what are you going to do about this? And a year later, they passed legislation prohibiting the institutionalization of any child under 2 unless they were handicapped. So, and then, of course, we then started an institute to educate the government and others about the hazards of institutional care. So sort of collectively, those are some of the issues. Now, what's sticky is that as we move to try to replicate this, now that and also, there was never an RCT like this before, so we really didn't know the outcome. One of you asked the question of Kim before about, well, what if the cash transfer doesn't work? We faced the issue of, what if the kids we put in foster care don't get better? That will confirm for the government, just keep them in institutions, right? But we had to take that chance. So I think that if we replicate this study, now that we know the kids don't do as well in institutions as in foster care, we can't do a simple replication because we do know the outcome. So we have to do something else entirely, and that's what we're thinking about in Brazil. So that's sort of the brief version. Does that answer your questions? I think it's really important because I remember lecturing our second-year medical students once, and we spent 45 minutes on the ethics of this, and I'll give you one example. I didn't say this before, we had 136 kids in the institutional group to begin with, but we screened more than 180. We screened out any child who had an obvious neurological or genetic or problem, because we only wanted kids that we thought to be healthy starting. And the reason is that if we had kids with handicapping conditions who didn't benefit from the intervention, we'd wash out the intervention effect, and the government would say, keep them in institutions. But the students said that was unethical. You really needed to consider adding kids with special needs, which is exactly what we'll do in Brazil. We'll have kids who have various disabilities because it's no longer ethical to withhold treatment from those kids, even if the treatment might have to be catered to their specific issues. So does that help? Yeah, I can send you all the papers. So not only have we written about this, but one of our papers was published about 10 years ago in Science. There was a commentary on the ethics of it that was actually longer than our paper. And it was written by Ezekiel Emanuel, who was Rahm Emanuel's brother. He was the chief of staff under Obama. He's a bioethicist. So I can give you all, send me an email, I'll give you all the papers. But now.
And the other thing to consider is the work has had a most enormous effect internationally. And, you know, everybody recognizes now that institutions are not good. Whereas, you know, there was some debate about it.
Right.
I mean, so, but still, it's no justification for harming a child, even if you're going to benefit lots. You know, the end doesn't justify the means, but it does have enormous benefits. Sure, that's why, for instance, with the severely malnourished children, we decided we couldn't do randomized control. We would just observe what's going on this year, and then next year we'd introduce the intervention. But it didn't have the impact scientifically or policy-wise. I mean, people are still not playing with children who are severely malnourished in hospital. Right. Go around the world. If you were going back to your countries, go and visit what happens to severely malnourished children if you have them, and see if they have a play program. I beg you. And if they don't, write about it.
I just, a quick question to you, Sally. I've used that slide that you showed in the middle, and so has UNICEF, of your 4-part randomized controlled trial. But one of the points that I and UNICEF make is that actually if you had to choose between two interventions with chronically, not acutely malnourished, would you stimulate or give food?
Stimulate.
But you didn't make that. I just wanted to make sure you're still making that point because I am, and I don't want to be wrong.
I ran out of time badly.
Okay,
so, but the long-term effect of that study, the benefit of the food washed out.
Yes, and the stimulation.
But the stimulation actually got stronger as it went on.
I have a second question to all of you, which was the child labour question, which again is another argument. I've had children and families, actually, and we can take Philip Airy's History of Childhood. Children have always worked, and you could argue that work can be stimulating and caregiving and bonding, and so I'd like to know what you think about the protective effects of child labour. Sorry to raise a big controversy right at the middle of...
The second caveat, we're not experts in this area at all. I think, chores can be advantageous and helpful for children. Most parents make their children do chores for the reasons that you're saying. It's helpful to build responsibility and independence. So to a certain extent, yes, I think that things like chores in the household can serve positive purposes. Again, I would just say it's the challenge would be when any sort of child labor is taking away from other opportunities that children have to be children and to learn and to develop and to play and to be in school, or when those contexts are threatening to the children in some kind of way. So again, I don't have a very good answer to your question, largely just because I'm not an expert.
The last question.
Okay, hi. I'm going to stand up because I'm very short. So, okay, so I wanted to ask you about the interventions that you do with the people that are doing the interventions. Because I have been reporting this in Chile, and I have seen two things. On one side, especially in very poor and deprived environments, social workers and psychologists that work sometimes, they are very stressed. They are actually giving up and resigning. They say, I am doing this work with this child that had really, they are struggling. And I see that the system is not supporting me, I have very low pay, and they just give up. That is one thing that I have seen. And the other thing that I have seen from the side of the parents, that sometimes they receive people in their houses, and they told me, I know they are doing this because they think that we need help. And yeah, maybe we need help, but sometimes they're making us feel like we are stupid. We don't know how to take care of our child, and sometimes that is a little bit violent and creates a wall between the people they are working on the intervention and the family. So how you address that topic?
I think that's an important question, actually. And that's why I did manage to keep that one slide in about relationships, because we found it very important. And one of the things we did, which was novel at the time, I think, was to have specific aims for the visitors. And they were to improve their self-esteem. And most of our first visitors immigrated, They got good jobs in the States and they were gone because they learned a lot and they felt better about it. But we worked very hard on having a team spirit. We're all equal. We're all in this together. We would have get-togethers and we all get together. And I think that's part of the secret of the success of the program is we have to stop the supervisors just checking a checklist. Everyone's very keen on these checklists and things and telling them what to do. No, I'm your friend, I'm here to help. We're in it together. And then if they're talking down to the mothers, they're bad visitors. They're not being supervised properly, they haven't been trained properly, or they're just not suitable for the job. But this is why I say quality is important. You could potentially do harm if you're bad enough. The other thing is, I do think it's important that the visitor should have at least as good an education as the mothers they visit, preferably a little better. Because, if I've finished school and you haven't and you're telling me what to do, that causes resentment. Oh, and we have had terrible trouble with caste. If I'm lower caste and I'm coming into your house and telling you what to do and you're not lower caste, whoa, So we have to be very culturally sensitive and everything else. But it's very important, and we run special workshops and bonding workshops and all sorts.
I think we need to draw things to a close. Let's thank our speakers again.